The 4 stages in pressure ulcer formation relate to observable tissue damage. We are going to be demonstrating a stage 3 pressure ulcer today, dressing change replacement. The stage 3 pressure ulcer is a full thickness skin loss involving damage or necrosis of subcutaneous tissue that may extend down to, but not entirely through, underlying fascia. The ulcer presents as a deep crater with or without undermining of adjacent tissues. We'll be demonstrating the bandage removal and replacement of this stage 3 pressure ulcer.
You didn't get any of that floor action, huh?
I did.
More water, nurse?
Okay, now that you have seen an exaggerated version of the incorrect way to change a stage 3 pressure ulcer, we are going to demonstrate the correct way to change this dressing. So you will go ahead and remove the existing dressing carefully from your patient, with constant awareness of maintaining skin integrity to the best of your ability. All of the dressings that are currently being removed from the patient will go into an appropriate biohazard receptacle. When you are removing the old dressing, you want to be cautious that you may be debriding some of the base of the wound, so careful removal is essential. Once the old dressing is removed, you're going to begin the process of assessing your patient's wound. We will put on sterile gloves before we go back at that pressure ulcer to make our assessment. Okay, now with sterile gloves donned, we are able to go ahead and begin to set up our sterile field for the dressing change. As we set up our sterile field, we are going to be assessing the patient's wound for a number of things. We are looking for skin integrity, approximated edges, and any granulation tissue that may be from the base surrounding the wound and inside deep in the wound, the turgor, the skin surrounding the wound, cracked, moist, or any macerated margin, odor assessment, any drainage, color and appearance of the pressure ulcer, a pain assessment, vitals, temperature being number one, would be the most important vital sign to be aware of, and a peri-wound assessment. Measurement of any wound depth and tunneling as well. Now that our sterile field has been prepared, we will begin to redress the pressure ulcer. So using the moist gauze, we will repack after we debride the wound very gently. Once it's been efficiently debrided, then we will begin to lay our clean bed of dressing. The packing material that is chosen is per doctor order, depending on size and stage of the pressure ulcer. Choices being sterile gauze 2x2, 4x4. When packing a stage 3 pressure ulcer, when we're doing wet to dry, one thing you want to be extremely aware of is not pulling the dressing from the margins of the wound down into the ulcer. You want to begin at the center of the ulcer and work your way out as to not drag anything non-sterile into your wound. Notice how carefully the excess sterile fluid is being drained from the wet dressing to make sure it is not too moist. Being careful not to place too much pressure, but being sure that you have filled in all the appropriate gaps. Once the wet dressing has been replaced in the stage 3 ulcer, we will then cover that part of the dressing with dry, sterile gauze, approximately covering at least a 1-inch margin around the wound. Then placing a sterile abdominal pad additionally over that sterile dry dressing for proper and appropriate coverage. And using the appropriate tape choice to secure your final abdominal bandage over your stage 3 pressure ulcer.